The following is a summary of the health insurance plan for the employees of Vandiver Steel Fabrication, effective April 1st, 2018 through March 31st, 2019. My name is Barry Hamrick. I'm always here to help. If you have any questions or problems about your health plan, or if you're just looking for some coaching to be sure that you get the most out of your program, please reach out to me directly. My cell phone number 205-222-9440. My email address rbhinsurance@gmail.com. So let's get into the details. Your health plan has two parts. Part 1 is your primary plan through United Healthcare. Part 2 is your gap plan or secondary insurance plan that's designed to pay most of your out-of-pocket associated with your primary plan. It is important to know how this plan works to be sure it is working for you just as it should. This is an amazing health plan, but only if it's working for you properly. We're going to get into the specifics on how this program operates, but first let's look at a breakdown of the benefits. This year, your gap plan is going to pay $20 for your first 8 office visits. That will effectively turn a $30 office visit copay into $10, and it will turn a specialist visit into $40 or $70. Keep in mind, though, the gap plan is only going to pay $20 of that office visit copay. If you exceed those 8 visits, your gap plan will no longer pay a benefit towards that office visit copay. The peach-colored section shows the outpatient major medical benefits with your health plan. Things like an emergency room visit, major diagnostics such as a CT scan or MRI, or outpatient major medical surgery. Your gap plan is designed to pay the first $3,500 of these expenses for you. The section in green represents your inpatient major medical benefit with this health plan. As you can see, your gap plan is designed to pay the first $5,000 of those claims. You will note the gap plan does not cover any portion of your prescription drug costs. Your copays will either be $15 or less, $45 or less, or $80 or less. Later in this video, we are going to discuss ways to get your prescription drug costs down considerably. It's important to know exactly how this plan works so you can monitor to make sure it's working perfectly. Step 1, your healthcare provider will file the claim with your primary plan, United Healthcare. Step 2, United Healthcare will process the claim. They will confirm it's a covered benefit, they will apply the discount for going to a participating provider, and they will pay the claim according to your benefit schedule. The healthcare provider and you will receive a copy of the explanation of benefits, also referred to as an EOB. Step 3, your healthcare provider will file your claim with your gap plan. They submit the EOB along with the original claim paperwork. The gap plan pays your out-of-pocket costs on your behalf directly to your healthcare provider. You do not have to file your own claims. Your gap plan pays up to $3,500 for major medical outpatient claims and an additional $5,000 for inpatient major medical claims each calendar year, so that means most of you will not have major medical out-of-pocket expenses thanks to your gap plan. Perhaps the number one thing you can do as a consumer to control your healthcare spending is to be a smart consumer when it comes to your prescription drug benefits. Simply put, if you're prescribed a medication that costs more than $15, there's probably a way to get that exact same medication from the exact same pharmacy at a lower cost by employing your copay card. Copay cards are designed by the pharmaceutical manufacturer to pay a significant portion of your costs. You can ask your pharmacist about copay cards, or you can go to a website called goodrx.com, or simply Google the name of your medication followed by the words copay card. You can also learn more about your medications at goodrx.com, blinkhealth.com, and you can check to see if you qualify for the patient assistance programs at needymeds.com. I'm also here to make sure that you're getting the most for your money, so you can always reach out to me and I'll help you investigate. The message here is pretty simple. If you're taking a medication that costs more than $15, there is probably a copay card or discount card available made from the pharmaceutical manufacturer. These are easy to locate and easy to use, and it can save you a lot of money. So I think you will agree this is a great health plan. However, you do have to make sure it's working properly for you. So here are a few tips on what to watch for. First of all, be sure to give both of your insurance cards, United Healthcare and your Gap plan, to your healthcare provider every time you use your plan, other than at the pharmacy. Another very important thing to do is to open your mail to monitor your claims process. You will always get a paper trail showing exactly how your claims have paid. If you get an unexpected invoice with a balance due, take note if the claim has been filed with your Gap plan. If you don't see mention of your Gap plan, the healthcare providers may have neglected to file it. Have your insurance card handy and call the number on the invoice and remind them to file with your secondary or Gap plan. If you had several claims or a large claim, it's possible you have exhausted your Gap plan. You can always call the 1-800 number on your Gap plan card to confirm if that is the case. If you're still having problems, I am always here to help. Call Barry 205-222-9440. Here are a few more tips on how to get the most for your money with your health plan. First and foremost, be sure to always use a participating provider with United Healthcare. That means you should check every single time you use your health plan, even if it's with a doctor you've seen before. You should tell them to please only use participating providers with United Healthcare for your lab work and also when other healthcare providers are going to be involved with your care. Tell them to make a note in your chart. One thing that's good to know about your health plan is you get better deals if you go to freestanding facilities that are not part of a hospital. If you need an MRI or other major medical procedure, please ask your provider to utilize a freestanding facility outside of the hospital to ensure you are getting your best deal. Keep in mind, if your doctor refers you to another doctor or facility for any reason, that is not a free pass to go outside of the network. You still must confirm that your doctor is a participating provider with United Healthcare. This includes lab work and other tests as well. This health plan does not require that you go to a primary care physician before you go elsewhere, so you are welcome to go directly to a specialist without a referral. Anytime you have a major medical procedure scheduled, call your healthcare provider several days in advance to confirm it has been approved by your health plan. It's a good idea to see to it that your healthcare provider gets approval for the procedure before even scheduling. The last thing that you want to have happen is to find out the day of or the day before that your healthcare provider had neglected to get your procedure approved. We don't expect that you've memorized everything we just talked about in this video. The good news is you always have access to me in case you have any questions or problems, or if you're just looking for some coaching about a medical procedure you have coming up. You can reach me on my cell phone anytime, 205-222-9440, or you can reach out to me via email, rbhinsurance@gmail.com.